Hi, my name is Dr. Renn, and I'm going to talk to you about laser therapy, class 4 laser therapy in sciatic nerve pain. When we add class 4 laser therapy to a patient's treatment plan, it's for a couple reasons. A couple of the main reasons are for it decreases pain and inflammation, and also the other thing it helps to do is helps with regeneration or healing of the body. We're going to talk a little bit more about that healing and regeneration when it comes to sciatica. Sciatica happens when there's been nerve damage done in the spine or in the sciatic nerve itself in the glute area. So what we do when we have laser therapy is we have photobiomodulation. What that is a fancy term for the light entering the cells and stimulating the mitochondria to produce more ATP. That is the cell's energy, and it gives the cell what it needs to do to regulate itself and to heal. So it prevents neural apoptosis, which is as bad as it sounds. It's the dying of the nerves, and we don't want that to happen. So after we prevent that, it enhances the growth of new nerves, the neurite growth. And you can think of neurites as like little filaments coming off the nerve to help it regenerate. Just like you have a plant and you have the roots there and you put in a little water and you see them start branching out all over the place, the same thing happens with your nerves. And it's just truly remarkable what light and its right wavelengths and penetration into the tissues can do. The advantages of using class 4 laser is that it's non-invasive and it's painless. It respects your body's natural healing response and enhances that healing response. So it makes the time that you have to recover from an injury shorter. There's no downtime after you get it. You can resume your normal activities right away. It's safe, it has no side effects.